Hi, everyone. Welcome to our Health and Wellness Talk Show. I'm Dr. Daniela Steyn. I'm your host. Today, I am so excited to have Dr. Sabina Nagpal with me. Hi, Dr. Sabina.
Hi.
Welcome. Thank you for being here.
Thank you for having me.
Dr. Sabina Nagpal is a psychiatrist. She's trained through the University of Ottawa and she did her residency at Dalhousie. She is specifically trained to help people like you. So, a lot of our audience are going through hormonal changes, and that is something that you have extra training in. You've done your fellowship in psychotherapy specifically to help women navigate their hormonal health, whether it's postpartum or whether it's perimenopausal. And I know after my book Thrive Through Menopause, we've had so many people reaching out specifically towards that, where they would say, I am on hormone replacement therapy, but I still need something. I need something a little bit more. Then a lot of women then reach out and say, I'm at this pivotal part in my career. I do need, but I'm experiencing burnout now that I'm perimenopausal. I'm really at this place where I can thrive, where I can become the next CEO, the next director in my department. But it's so critical because all of these things interplay: our menopause, our hormones, our physical health. And that is where you are an expert in. It's the whole biocycle social model of being well. I'm so excited. Thank you that you are here.
Oh, thank you.
I think without further ado, I'm going to ask you to just start by telling us yourself a little bit about you, your training, a little bit about your background first.
Sure. Yeah, so I'm a medical doctor by training, as you mentioned, Canadian trained, but I've lived all over. I've lived internationally in many countries and practiced medicine and public health and many things in many countries, which I think is an important part of my background because I like to understand people's experiences, and I think my living in various places has taught me a lot about that. And so I did a psychiatry residency in Canada, and then I did a fellowship, and I also did a master's in public health. So I really think about kind of systems and health. Throughout my work, I have learned a lot about some of the challenges that people have to achieve that next level, as you kind of described, right? Where people can find maybe a level of health, but they can't get to that next level of kind of what I call fulfillment. And so in my kind of reflection on that, I thought about how I might want to contribute to this real problem, actually. And what I realized is that many people find success, but they don't find fulfillment. They don't get to that next
And that's
level.
big. That is very big. How often do we see this? That you, especially for us as doctors, and a lot of our clients, both of us are medical doctors, very high functioning people in their career, but then you feel you worked so hard to get here. You're like at the top of the mountain, and as soon as you get to the top of the mountain, you see, oh, there is a higher mountain to be climbed.
Yes, exactly. So I created this. I created my business called Radiate Mind, to address this very problem. So I work with,
and it's very successful. We'll put links below if our readers are interested in this. You don't have to take notes. We'll have everything in the notes below your website for Radiate Mind. Okay, tell us about Radiate Mind.
So I started this for this very problem. What I saw is that people get stuck in exactly what you just described, Daniela, where they get to this achievement and then they look for the next one. I call that the overdrive state. So I've created a model of the states that we get into. The overdrive state is one where we continue to tick boxes, achieve our next goal, go to the next thing, are always kind of running on this, what I call anxious energy, because we get used to developing a pattern of just check, go, go, go. But that has serious consequences to us. One, for our well-being. People don't usually find joy, clarity, or ease in that state.
Oh, and you have to go slower. It's like joy, clarity, and ease. It's quite profound. Because I'm one of those people who like to go, check boxes, do the next thing, run the next race. But to just reflect, and I encourage our listeners or our YouTube watchers to do it just for a moment. Think where you are now. Do you have joy in your life? Do you have clarity? Do you have ease? If you have, good. Please email me, tell me all your secrets, and we'll tell.
Yeah.
But if you don't, we'll get to it. Things you can do to get there.
Okay? Thank you. It's so true. And just to be fair, I don't expect people to get that all the time. But we have worked, for those of us that have thought of our lives and worked really hard to get to a certain level, I think most of us have thought that we would get that when we got there. And we deserve that. So that's the well-being piece, right? That's the kind of the fulfillment model. There's the well-being, so that's the joy, clarity, and ease. Then there's the health benefits, right? So I'm sure you see a lot
Which
of
is
that.
big. That's why I started this clinic. Yes.
Yeah, because you see people get stuck in this kind of go, go, go race, and sometimes they wait maybe until retirement to think about their health, but by then maybe some of their health, the consequences of their health are kind of further on.
There's a great book by a Canadian doctor, Dr. Gabor Mate, When the Body Says No. And I encourage our audience to really look at that book. So listen to the book, get it on Audible. The book really delves into it, where quite often, especially as moms, women, we absorb everything in our families, from our husband's work stress, maybe your children's anxiety through school. You tend to absorb everything because you can handle it, because you can. But then it happens at a certain point when your body says no. And that's often when I would see people when they've developed that autoimmune disease, or they develop metabolic disease or diabetes. It's at a point when your body says, I cannot physically cope with all the emotional stressors. And then if you then developed an autoimmune disease, it doesn't help to just treat it with pills, because it's not or you develop diabetes, your body doesn't have a lack of diabetes medication. Your body doesn't have a lack of antidepressants. Your body really has what you're talking about that needs to be addressed to your wellness, your ease needs to address before we can treat that illness. So that interlocking between your mind and your body that we really cannot take apart, that's what you work with.
Exactly.
And you have a good understanding because you're the medical doctor, you're a psychiatrist, but you've also done more training in that psychotherapy.
Yes, exactly. So the psychotherapy helps me understand, as you said, the psychological aspects that have led us to get to this place. And as you described, we absorb that because we can. But to be fair, we're also really well rewarded in society to do it. And I think that's why we keep on this train, because people say, good job, you helped this person, you achieved this. And we're sort of continually praised for taking those steps to put our own needs away. But it becomes a pattern. And I see with a lot of people that sometimes they get to the state where maybe they don't need to be doing that anymore. Maybe they no longer have that pressure. Maybe their kids are grown, or they just don't have to check any more boxes. But now we're in a state where we've developed a pattern. That's just a pattern, and it's one we know. And it's worked for us all these years to get the praise we needed, or to get the achievement we wanted, maybe to get the relationships we wanted, until it doesn't. And as you described, the tip of the iceberg is when you get to these autoimmune illnesses, or really kind of symptoms. But even underneath that, there's a lot happening before
we want to treat you before you get there.
Exactly.
Yes, that's why we have this clinic.
Yes.
That's why I opened this clinic. So quite often when I see people in hospital, they will tell me, oh my goodness, I wish I met you 10 years ago, 20 years ago. And OHIP doesn't cover for people for preventative, to prevent, OHIP really just covers some essential things for that end of disease, when you need dialysis because of end-stage renal disease, because of diabetes. But if you want to prevent it, you can 10, 20 years before. And that's where we're talking about. We want to prevent things.
Exactly. Because if we stay on this road, we know what the consequences are going to be. That's exactly.
And for you to be that great mom, to be that great wife, to be a great physician, you need your own cup to be filled, to be able to pour into the lives of others. I mean, something we often hear is that people don't have time for this. I would love to, but I have aging parents, and I have a full-time job, and I have little kids. I don't have time to invest in myself. We know from experience that you are a better mom, a better kid, if your own cup is full. Then you have a better capacity to care for other people. It's like in the airplane when we put our own oxygen on first, right?
Exactly.
And then, but same thing, we don't want to wait till we die in the airplane crash. Before that, to be able to give more. If you're just so well-rounded and full, and you're just so abundantly full, you have more to give.
Exactly.
And that's where you come in. You work with people to help them get to that.
Yeah, and so we've talked about the health, and then sometimes the motivating factor is just what you said. People don't feel like they have time, but what they don't realize is when you do put effort into the strategies that I offer to people, you actually create time because you perform better. right? So when you're operating from this state of what I call fulfillment, you actually have better capacity for problem solving. You can integrate kind of competing priorities better. All of us that have, should I do this for my kids or should I do this for my parents? Should I do this for worship? So when you're in a more fulfilled state, you waste less time and energy on kind of those difficulties that we get into our heads about. You also are able to use your intuition more effectively. You're more creative. So actually what I've seen is people's performance actually increases. So you have to invest the time, but it pays off with more time in the end. And so when I think, my approach, I try to bring well-being, as we talked about, health and performance, all three, through the strategies that I use.
So so when people see you, it's not like a typical psychiatrist. It's more like seeing a high performance coach, the same that an NBA player will see a coach. People can come to you for that. So if someone does work with you, what does it look like?
Yeah, good question. So it's important what you just said. I start from a place of relative wellness, right? So, we wouldn't be managing an active depression or, an active anxiety disorder. People would be functioning with some level of success and want to be better. And as you said, it's more on the kind of preventative or performance side of things. So I work with individuals and I work with groups both. And I also work with organizations, so kind of all three. But I start, because I'm a physician, as you know, we need to do a very good assessment. So I don't just start willy-nilly offering people strategies without kind of really understanding comprehensively what is going on and where did things come from. And so when you work with me, we sit down, we do that kind of hard work where we understand how you got to where you are, right? So how did things end up in the way that they are now? Understanding maybe your early life, understanding your patterns of relationships, some of your beliefs that maybe aren't serving you.
That's key. That is key. So for a lot of people that we work with, when we start going through this, they'll tell me that, maybe they had a very critical mom growing up and she maybe didn't know any better. That was her way of saying, sit up straight, play piano. Why did you only get 95% in your test? Can't you be better? So maybe you had a critical mom growing up, but that was the first 16, 20 years of your life. Now at age 60, you had 40 years more where you have been that critical voice in your head, where you are continuously telling yourself you're not good enough, can't you do it better, can't you do it better? So it's so important to understand where you come from, but then also to understand what is that dialogue in your head now, and how are you holding yourself back now?
Exactly. Yes. So it's about unlearning these kind of what I call blind spots or triggers and traps that stop us from moving to that next state. Most of us know that we should do more self-care or that we should take better care of ourselves, but something is holding us back. And usually that comes from some of these kind of psychological traps. So my model always focuses on both sides. What are the things holding you back? But beyond insight, beyond what you might do with a regular therapist where you just learn about those critical times in your life, I also teach a method of kind of what I call filling the gaps in the foundation. So we find the cracks, but we fill them up. And we fill them up with two things. One, very good high-yield self-care. So that would probably be a lot of maybe...
I like the way it sounds, high-yield self-care. That sounds good. I want to do that.
Yeah. Well, the reason I do that is because no one has time to do all of the things that we should do. That's the reality. Right? So no one has time to do all the exercise and all the diet and all this. Like we don't. So what we do is we find out what is it that you need? What is it that works best for you? So you can focus on those areas of self-care that are really high yield. That's really important. And then the other thing that I do is I bring in practices that help to ignite your inner fire, that help you to really sustain this side of you that keeps you going. And that's very energizing. That's very different about the work that I do from many other practitioners. I call these spirit nourishing practices. You don't have to be spiritual, you don't have to be religious, but every one of us has something inside us, this kind of inner fire that keeps us going. Or at least we had it when we were kids. And we want to bring it back.
And it sometimes helps to reflect when you were a kid, what drove you at that point, what gave you energy, because we often lose that, or we forget about that. Mm-hmm. And then that's what's really helpful. So I would recommend to people, because I know we have listeners all over the world, if you maybe don't have access to Dr. Sabina Nagpal, but do you offer...
I work internationally.
Internationally, perfect, mm-hmm. Perfect. Yeah. But I encourage all of you, even if you don't work with Dr. Nagpal, to really reflect on your own life. Who were you? when you were a little kid. Go onto our website. There's a value finder. And just do a free value finder that you can download and find out what are your values. If you do things every day that's aligned with your values, then you're going to have more joy, more ease, more flow in your day to day than if you're doing things that are not aligned with your values.
Absolutely. And there's also very good evidence going along with that for things like exposing yourself to nature, which helps to slow down our kind of autoimmune or our high cortisol levels. It in itself is a very useful strategy. So that's one thing I usually suggest to people that have never thought about how to ignite their inner fire, to get into nature, music, the arts. There's many things. I love your value finder. That's great. But I think even other strategies too that people can just kind of handpick.
That's big. You can have blogs on my website if you want to look at that, and more YouTube videos specifically on nature therapy, ecotherapy. There's one on laughter therapy. I often tell people when they're in a hospital with chronic pain or severe, after cancer treatment and radiation and pain and severe pain, that there's nothing that I can tell them to make them better. So what I often say is to consider laughter therapy, where you look at stand-up comedy and shows to get to that point where you really start laughing and release all these feel-good hormones. So there's a lot of science behind that. The nature therapy is a big one. I know a lot of our podcast listeners will email me and say, oh, they've gone on their walk and they listen to this podcast or that podcast. So to consider that, there's all this research that when you walk between trees, it really stimulates your parasympathetic system. So you work with people who are very highly driven, successful in their career. Typical about these people is that your sympathetic nervous system gets stimulated the whole time. So your adrenaline is getting stimulated, your cortisol. It's great. These things does help us to perform well. It helps us to get through med school. It helps us to be successful in our career. But for that to be stimulated consistently over a long period of time, it really leads to burnout.
It definitely does. Yeah, it's not great for our brains. It's not great for our bodies. And we get stuck in this pattern where our cortisol is just firing all the time. I always say it's useful to have it, but we're not always running away from a bear in the woods, right? Yes. We need it. We definitely need that capacity to respond with the sympathetic nervous system, but we have to reset it. We have to find the balance.
And nature is one of the easiest ways to reset it. And a lot of you who follow me on Insta will see on my stories every morning after I drop my girls off at school, I will go to the lake just for 5 minutes. Yeah. And just so that I can see the water, because I learned in my life that just seeing the waves helps me. We go for a walk between the trees every night after dinner. My kids are preteens now. They do not like that. Even my youngest, why do I have to walk? Why? But all the research shows us that is the easiest way to reset that. Yep. Because it is hard. We know it is hard. You have so many demands at home. It is for you to go into a deep meditation might say it's difficult. But just to walk between those trees after dinner, go for a quick walk, that's a very easy way to really just reset your stress response. Get that deep breathing.
Absolutely, yeah. So I usually suggest this, as you said, when you go to the lake and look at the waves. I call that a nature observation, right? So you observe nature for 3 or 4 minutes, and all you're doing is observing. You don't have to do anything. You don't have to fix it. So don't go get in your garden and pull weeds. That's not the goal. You're just observing what's around you. And in that, what we're doing is we're teaching our brain to stay in the here and now, as opposed to, which is the antidote to anxiety. Anxiety is moving into the future and predicting it negatively. That's all it is, right? We're just moving there and we're saying something bad is going to happen. Because if it was something good, we'd be excited. We're not. We're anxious. So, but a nature observation brings us into the here and now. And we're just allowing ourselves to recognize that we're not in control of this moment, that it's something outside of us. And that helps to decrease the stress response and invites our parasympathetic nervous system to take over, to give us a break.
Yeah. And same with depression. So the way that anxiety jumps into the future, depression is people are more likely to ruminate over past things. That is replaying things in your mind. And that also helps to pull you out of that. If you replace that replaying in your mind for bad things, if you just replace it with the here and now.
Yeah, exactly.
And you cultivate that feel of gratefulness, happiness, joy in the moment.
That's exactly right.
So this is very helpful. Everyone who's listening to this, watching these are things that you can implement today in your life. This is the investment that you made watching this, and we're very grateful for your time. We know your time is valuable. It's valuable to us. We're grateful for you watching, listening. This is something you can take home that will improve your quality of life right away. To add these moments to your life where you stimulate your parasympathetic nervous system. This will help elongate your telomeres. This is really things that's going to help you throughout life. If you just add these things, instead of anxiety, replace it with being in the moment. Instead of ruminating on the past, replace with being in the moment. This is very helpful. Thank you.
You're welcome.
So the next thing that you tell people, like some maybe easy thing that can improve the quality of life for our listeners. Any other wisdom you want to share?
So that's the spirit nourishing we talked about.
Yes.
The self-care piece is I use the acronym NEST, and I use this in my clinical practice in NEST. So it started off with the kind of work that I used to do in pregnancy, postpartum, like building a nest, but I realized that it works everywhere. So it's nutrition. And so that's 3 good meals a day, lots of water, ensuring we stay away from...
Don't go too fast. This is what I'm passionate about. Passionate. So I'm double board certified to the American Board of Lifestyle Medicine. And that's what I'm so passionate about, whether you're working with an executive coach, with a psychiatrist, postpartum, menopausal, or whether you have diabetes, weight loss, whatever the thing is, we look at those 6 pillars of health from lifestyle medicine. But you summarize it in this NEST in 4 letters. So NEST, your nutrition. The majority of women that I see in this clinic are either overnourished or undernourished. This is such a shock. And so you've also, apart from everything we mentioned, you're so accomplished, you've also done tropical diseases. Where you've been through Africa, you worked through all over the world, where you know profoundly the impact that nutrition has. So I studied in South Africa. And we've done a lot of work. My mum has been this pioneer in the field with really helping improving people's nutrition, and we've seen the incredible impact protein has, vitamins have on people to prevent kwashiorkor or marasmus. So the incredible impact food has. So I was so surprised when I came to Canada, when I came to Oakville, which must be the most affluent neighborhood in the whole of Canada. When I test people, when I admit them to hospital all the time, I would test everything. Magnesium, calcium, vitamin D. I just test for everything. And I would find that they are so depleted. And that was such a shock. And here in my wellness clinic, quite often women who are high performers, if we look at their nutrition, they're on a diet of coffee. They're so malnourished, and on the outside you might look normal, you might look like you're in great shape, but you're like literally every day taking nutrients from your bone density, from your muscles, because your body is great in the way that everything tries to stay in homeostasis. So even if I do blood work on someone and we test the magnesium, it might look normal. But it's because your body wants to stay within normal limits, your blood work, so it will take nutrition if it's not coming from your gut because you don't have any magnesium in your diet, you didn't eat enough spinach and broccoli and things, then your body will then take that from your muscles. And then over time, your muscles really get replaced with fat. So even though you look good on the outside, when you do a body analysis, you have more fat than muscle, or it will take calcium from your bones. And then by the time that you're 60 or 70, you're more likely to have an osteoporotic fracture from years and years of not adequately nourishing your body. Okay, so that's big. So I'm very passionate about this. You were at the end.
And sorry, I usually go through these quickly because
I love it.
Yeah,
I'm going to go through this for hours.
So much, and I'm learning too, which is great. So nutrition is the N. E is exercise.
Go slower with exercise. So when the people you work with are high performance CEOs of companies, they are exercising. They may be doing their spin class every morning, but now when you're perimenopausal and you burned out at work, burned out with your family, and now you're burning your life out with doing too much exercise. I'm an endurance athlete, so I'm so guilty of that. It just feels so great when you just keep running.
Yeah.
So talk a little bit about exercise.
I think the key is that we can tend to over exercise because it gives us. Me too. I get that high right from. I used to love to do really high intensity training, because I get that kind of adrenaline rush after, and I have to really make an effort to do lower intensity training. Yes. Go for walks, go for swims, strength training. Of course, I'm trying to integrate more and more of as I enter perimenopause, because I want to, make sure I preserve my muscles and my bones. And it actually takes more effort than it used to, than just like boom, run or boom,
it's easy to lace up your shoes and go for a run or go for a spin class. It's way more effort to do strength training.
It is,
especially as women where we're not really conditioned to go to the gym, to make that mind switch. And often when women tell me that, or men, when we see people for longevity who tell me, oh, I've never been in a gym, I don't want to be in a gym. If you don't go to a gym or a home gym where you do those weights now, you will have to do it if you fractured a hip in the hospital. We put people in a gym for the first time when they're 90 years old, when they do rehab to recover after a fracture. So you can never say you're too old to start going to a gym.
It's true. It's really true. I do it at home personally, but you
don't need equipment. You can do it against your own weight. Just squats. To sit down and get up, things like that. Push-ups or planks, just against your own body weight. Good.
And sometimes with exercise, just as an aside, when I talk about that kind of high yield exercise, for some of us, when we get into this overdrive state, when we're on this go, we really can't settle our bodies down. We just are so driven, right? We're so kind of in this sympathetic drive. Sometimes expending energy in that way, in a very high intense way, is okay. I do encourage people to do that, because the trick is to know yourself, is to understand what state am I in. And I teach people to understand what state they're in, and then what can they do to kind of, as I usually say, get yourself out of the fire, right? So when you're kind of in that place where you just can't relax, you just can't calm down, you notice that you're kind of fighting with people around you a little bit more, or you're irritated by people around you a little bit more, you're not sleeping as well, maybe you're just feeling like you have these thoughts that can't stay in the moment, you're always in the future. Those unhelpful beliefs from your past are coming up. We get into these states. And in those times, using our self-care to kind of help to regulate is okay. And exercise in a more intense form for some can be really helpful. I would do that. If I'm in this, my husband will say that sometimes. Sabina, why don't you just go for a run?
My mom used to say that, yes, just go. Difficult teenager, just like go.
So just go.
You'll feel better when you come back.
And then I'll come back and I'll be like, sorry for getting mad at you kids for that little misgrievance. Yeah. I'm good now, because I just needed to burn off some of that. And then after that, I can do something like a nature observation. Then I can do something to nurture my spirit. But when we're really in this state, it's actually really difficult. So exercise, I think the key is to tailor it to our, our age or our current level of fitness, what our needs are in that moment. So there's lots of hormones.
That's very helpful. Yeah. So next, nurture, exercise,
nutrition, exercise, sleep.
So sleep we can talk about for hours. Yes. So in our menopause clinic, we see people for sleep all the time. And that's a big one. But then also the good thing about sleep, so psychotherapy has been shown, CBT has been shown to be more effective for sleep than any sleeping pill on the market. So that is something to know, that sleep is not just outside of your control. There's a lot that you actually have control over for sleep. So that is very, very, very valuable to know that. And that's something that you can help people with to improve not just the duration, but your quality of sleep.
That's the key, the quality. We actually get most of our impactful, that deep rest earlier in the evening. And if we get that, then we're actually okay, right? Then we actually can get through, even if we have an early morning awakening or some things our hormones are causing that are maybe interrupting our sleep. So it's not quite like it was. That's actually quite normal as we age for our sleep to change a little bit. But we want to make sure that we preserve the parts of our sleep that we really need. And that's early in the evening.
What time? If you tell your clients, what time should they go?
So the ideal world would be like stop all screens, stop any sort of blue light by like 8 or 8:30. And then you want to be sleeping. I'd say, everyone's a little bit different, but me personally, or what I advise people is like by 9:30, 10, you want to be kind of really winding down. 10:30, you want to be asleep.
And that's big. So I work with a lot of people who would come just for weight loss. And then when we look at weight loss, we have a very comprehensive program where we don't look just at one thing, just your diabetes or just your cortisol, we look at everything. And then one of the components would be sleep. And people are very resistant to this. They say, but if I go to bed 10 o'clock, who's going to pack my kids' lunches? Who's going to fold the laundry? That's the time kids are in bed, so that's the time when I get to do my admin, my this. But I haven't found to be able to help people lose weight if they don't sleep properly. Because even if you eat like no calories, if you don't sleep enough, your cortisol levels will be high throughout because you really need the stress hormones. And I saw it in my own life because as a doctor at the hospital, I'll work overnight. I mean, from a young age, as medical students through residency, we have quite a significant toll of working overnight. And that does cause you for the next 2-3 days to eat more sugar, to eat more carbs. Even if you do eat perfect, your body goes a little bit in that stress response. So you can't lose weight. So for weight loss, my number one is sleep. For people who are irritable, sleep. When people are depressed, and we also look at sleep, you don't want to sleep all the time, but to have optimal sleep, to be performing well, for brain fog, for really getting to that next level, sleep is critical. And quite often it's more helpful to have that optimal sleep and get up 5 o'clock in the morning and then do all the work you need to do. So that's a mindset switch for a lot of people. I have another couple of podcasts on this that you can look at. I have a blog on sleep on my website. But you really start wrapping your head around it that all the research shows you do get more quality sleep between 10 o'clock at night, 2 o'clock in the morning than you will get from sleeping in later in the morning.
Yeah. I've done exactly that in my own life, and I suggest it to others to just flip it. And actually, if you really think about it, when you're rested, all those things that you need to get done are
so much faster.
Right? So, and the house is quiet.
And I do it very quiet because as soon as I creak, my youngest will be up.
Yeah.
So even if I go training or things, I make sure I do it very quiet because if I want to go for a run and the kids are up, then I can't.
Yeah. I know, I get up really early in the dark. I change in the dark. All the things.
But yes, all the research shows that it is better, it is more helpful. Okay, so sleep, improving your quality of sleep is important.
Yeah. So the next one is T, time for stillness. So that is back to some of the spirit nourishing practices or things that help you to be in the moment, in the here and now. So anything that takes you takes you into right now where you have to be 100% focused on this moment, or you're trying to focus on this moment and you keep getting distracted, but you work to pull yourself back, that's also fine. So that time for some stillness. For some people, that's, as we talked about, nature observations. For some people, that's mindfulness. For some people, that's meditation, yoga. But things and any kind of focus on the breath can be really helpful for that time for stillness.
And that is something that you can get better at. So that is something that's been hard for me. I remember I used to go to perinatal yoga just at that point when I couldn't run anymore because my tummy was too big, and just standing there was like so hard for me. I couldn't do it. I would just be thinking about everything that I have to do and running from my head, or I couldn't do it. But it is something that you can get better at with training. It's like anything else in life. I have this analogy I often tell people that your emotions often, a lot of people come to us saying that you're mad or frustrated or angry, and then you teach that you can control your emotions. And that is something that you can learn with time. It's the same as horse riding. There's this story about a guy who's a bystander who asked a horse rider, "Oh, so where are you guys going?" And the horse rider says, "Oh, I don't know, ask the horse." And a lot of us do that with our emotions. We don't know if it's going to be a good day or a bad day. If someone says something bad to us, then it's going to be a bad day. If someone says something good, it's going to be a good day. We don't know where we're going. We just let the horse run free. And it doesn't have to be like that. You can learn a lot of emotional mastery of really riding your horse. And same way, if whoever's listening to us now, if you are here and you don't learn how to control your emotions, your mood, your thoughts, if you don't learn, you're going to, a year from now, 2 years from now, you will still not be able to do it, and you'll be like that horse just running free. And you can be like that the rest of your life. I do therapy with people in their 80s. So you can be not any better at 6 weeks from now, 6 months from now. But if you start from today on, same way as going for horse riding lessons, if you learn how to control your emotions and your mood and your thoughts, you can get better at it. And you're not automatically going to be better. Same way that we have to go for horse riding lessons every week. We have to learn. And first, when you go for those horse riding lessons, you just learn to groom your horse. You just become aware of the horse. Then you learn to sit correctly on the saddle, how to saddle your horse. Then you learn how to trot, how to canter. But 5 years from now, you can jump. So there's these amazing things that we can do, but you have to consistently, and the same thing with your emotions. First, you must just become aware of your emotions. Am I happy? Am I sad? Why? What is happening? Then you realize that this emotion is very fleeting. Emotion just comes and goes, but you made that decision to hold on to the emotion and to replay it in your mind. Emotions are, science tells us, like 30 seconds long, good or bad. But if it's good, if something amazing happened, your body realizes, okay, this is not a threat for your survival, and your brain lets go of that happy emotion. So say you got a raise at work. You feel, oh, this is happy, this is amazing, but it's not a threat, then it lets go. Then if something bad happens, if your boss gave you a glare at work, or your boss tells you, oh, you're horrible, then you think, okay, maybe this is a threat to my survival, and that negative emotion gets replayed. But it's not the emotion. The emotion you can let go of. And that's what emotional mastery really teaches you, to let go of that emotion. It's your choice to hold on to that negative thing. And initially, we don't know that it's a choice, because we've been doing that for 40, 50 years. Because your brain thinks, oh, your primitive brain thinks, oh, this is a threat to my survival. Just replay. But through learning emotional mastery, you realize that this is an emotion. I can let go of it, and I can hold on to positive things and intentionally replay my positive things. So this is very helpful.
I love that. Can I add something?
Yes, please.
So,
please do.
Because my fellowship was in psychotherapy, so I think about emotions a lot.
Yes.
So I'd love to contribute. The other thing that I think happens is we are trained very early in our lives to get to push our emotions down. So I love your addition of the kind of survival mode. That's actually really, really nice. But in addition, I think, especially as women more than men, but everyone gets trained to just put our emotions away. And so when we do that, we sort of just say, oh, they're not okay, they're not tolerable, they're not allowed, but they live there. And so a lot of the work that I do is helping people to, as you said, kind of understand, reflect on, know our emotions are there, gain some kind of capacity to meta process, what I call. So look at, take ourselves out a little bit, look in, okay, what's my body saying? What's my emotions saying? What's happening with me? Understanding where we are. And then when we allow ourselves to experience our emotions, as painful as they are, as much as we don't really want to, they do pass, as you suggested, right? And the ones that I find the most kind of destructive, if you will, to our bodies and to our kind of mental health are anger, irritation. Especially as women, we're often taught not to sort of feel it or express it, but we feel it in other ways. We express it in other ways. The other one is shame and guilt, and then grief. So they just live in us. And on my website, actually, you can see I have a check-in, so people can check in on their fulfillment. And so I teach people below. Super. Yeah. So I teach people to check in and try to scan themselves. What am I feeling right now? When they have like a bit of a system to help you. So first looking at what is my body trying to communicate to me? Do I have pain anywhere? Do I have energy anywhere? Is there something in my chest? Is there something in my belly? So we look inwards at what are the signals from our body. And then we look at what is the emotion behind that signal? Is there some feeling that's going on there? And as we learn to know the patterns in our body, as you said, the emotions no longer rule us. We can see them, we can experience them, we can accept them as and just there and let them be.
It's just an emotion.
Yeah.
So it's not really good or bad. It's just to become aware, so all those emotions don't bundle up and cause a bleeding stomach ulcer or a back pain or something. You just recognize them.
Yeah. And sometimes the first step, we were talking about time for stillness and mindfulness. Sometimes the first step is actually just that, just checking in with ourselves.
Self-awareness.
Right? So, okay, what's going on with me now? That's a mindful activity in and of itself, because you're in the here and now, you're looking at yourself, and that can last 1 minute or 2 minutes, but very powerful as a starting place.
Thank you so much, Dr. Sabina. It was absolutely, absolutely lovely to have you. Yeah, I know.
Let me give you the last one of the nest.
Listeners is going to love it. Oh, we're not even done.
No, it's okay.
I'm
There's only
whoa,
one more.
I learned so much. I'm going to live my best life now with everything I learned. Okay,
so S is nutrition. E is exercise.
Sleep.
S is sleep. T is time for stillness. And S, it's nests.
Oh, nests.
Is supports.
Oh. So this is a big one.
Yeah.
So you're a busy mom, full-time working mom. Your husband has a full-time job. You have little kids. What do you do for support?
Good question. Good question.
So, and this is a big one, right? Because we think we should do it all. Like, why? Who told us that?
Yeah. So what I'd say I do is I have a lot of friends that are like very psychologically minded. I'm lucky that way. It happens when you're a psychiatrist. But no, I have very good friends that I book. I book a run with or a walk with, and that's a chat time as well. So we kind of have like it in the calendar once a week.
And you do it intentional. That's the thing that I find. If you don't book it, if you don't plan it, it's not going to happen. So you intentionally want to think, who are you going to run with? And that person is a support. Yes. Is it someone that sucks the life out of you, or is it someone that fills your cup? So to be very intentional.
Absolutely right. And I know exactly. So I have I do this with people I work with, but I do it for myself. You have these rings. You have yourself, and then you have people on like a bullseye, right? And we place people in our lives on that bullseye intentionally. So the ones that are closest to us and further out, and then we rate them for how much do they offer support, or how much are they sort of taking my emotional energy. It's okay to have people in your life that take your emotional energy. That's reality, right? That my kids take my emotional energy, my parents, people take my emotional energy. But I also have people that I know I can lean on to give me emotional energy when I need it. And so I have that intentionally already created, so I know where to go when I need support. So that's something that I always kind of take mindful of. And because I know, that some people might need more from me and some people kind of give more from me, if I don't have anything left in the tank, I have to just shut it on. I just can't have that conversation today. I'm happy to talk with you tomorrow or next week, but today my tank is empty.
But it helps to intentionally know that, right? Because if you didn't go through this journey, so I really recommend to everyone listening this, watching this, to kind of track the people in your life for the next 3 days as you spend time with people. Just write down the name, your husband's name. Is it giving you energy? Is he taking from it? Your kids, your mother-in-law, your sister, and see who you spend time with. There are people, same, that I realized after I started doing this, and it doesn't come automatically, but that there are people that I have to limit my time with. No, only one phone call a week. And if it's a second phone call that week, I just don't answer because I know I have to protect myself.
Yeah, exactly. And even think of times of day where I have more to give and I have less to give. So but it all comes from this awareness of what state I'm in. So I'm always checking in with myself to know where I am. And that helps me to guide what I can give, what I need to do. Do I need to be exercising? Do I need more mindfulness? So those answers are all a lot more simple when we know where we are. And so that's kind of how I strategize. But I have some key people that help to fill my cup.
Amazing. So support.
Yes, support. That's the last one of the nests.
And to realize that we do need support. If you look at anyone successful from a performance point of view, if you go and look at the people that are most successful in your line, in your job, in things like you, and you connect with them and you want to learn from them, that is really a key. I read Sheryl Sandberg's books and Melinda Gates' books, people who are very, very, Michelle Obama, Hillary Clinton, I've read all of their books. People who are very successful in life have people who help them. No one becomes incredibly, incredibly successful on their own. So to really be cognizant of your support.
Yeah, absolutely right.
Thanks, Dr. Sabina Nagpal. It was absolutely lovely having you here. I want to go for a run with you.
Yeah.
You sound like the person I want to hang out
with. I love that.
We're
both local. We could do that.
So for everyone watching this, we want to see your comments below. Please, we want to get your emails. Please click on the links and comment. What did you think of this video? What did you like? What do you think you learned from this? Thank you so much for spending time with us. We really appreciate it. And thank you, Dr. Nagpal.
Thank you.
Thank you for listening to this episode today by medical doctor Daniela Steyn. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.